Hi everyone, I am Galang-Gatbonton, and this lecture is about the nursing management of patients with infectious diseases, and on completion, the learners should be able to 1. Differentiate infectious disease from communicable disease, as well as the concepts of colonization, infection, infectious disease. Second, learners should be able to explain the chain of infection, and that would include the concepts of causative organisms, mode of transmission, incubation period, among others. Third, you should be able to describe healthcare measures to prevent, control, and eradicate infection. And lastly, as nurses, use the nursing process as a framework for care of patients with infectious diseases. First is the infectious process. An infectious disease is any disease caused by the growth of pathogenic microbes such as bacteria, viruses, fungi, protozoa, and helminths. These pathogens enter the human body and cause infection. What about infectious diseases versus communicable diseases? Take note that infections may or may not be communicable, meaning the infection is contagious, nakakahawa siya. But not all infections are communicable diseases. However, all communicable diseases are infectious ones. What about the role of modern science in controlling, eradicating, and decreasing incidence of many infectious diseases? This is where the significance of medical research has set in. For example, yung development ng vaccines. Pero, yung pag-increase ng ibang infeksyon, such as those caused by antibiotic-resistant organisms and also the emerging infectious diseases just recently, ang COVID-19. They are of great concern and a growing concern too. The nurse plays an important role in infection control and prevention. Educating patients may decrease their risk of becoming infected or may decrease the sequela of infection. In this lecture, we will actually discuss such methods. The photo shows the chain of infection, and 6 elements are necessary for infection to occur. These essentials are 1. The causative organism or the infectious agent. 2. A reservoir of available organisms. 3. The portal or mode of exit from the reservoir. 4. A mode of transmission from reservoir to host. 5. A portal or mode of entry to the host. And lastly, a susceptible host. Let us further discuss them one by one. One is the causative organism. Please remember that you may use terms interchangeably. Causative organism, microorganism, pathogen. They may mean the same. There are many microorganisms to list, but these 5 are the most common pathogens that cause human infection. Bacteria, such as tuberculosis, pneumonia, gonorrhea, tetanus, and many others. Viruses, recently, ang COVID-19, AIDS or HIV, influenza, measles. Third, fungi, candidiasis, athlete's foot, ringworm, histoplasmosis, among others. Fourth, protozoa, amoebiasis, malaria, and helminths. Ito naman yung filariasis, schistosomiasis, ascariasis. Second is the reservoir. Reservoir is the term used for any person, plant, animal, substance, or location that provides nourishment for microorganisms. In Tagalog, ito yung imbakan, pinaglalagyan, pinanggagalingan ng pathogen. The reservoir enables further dispersal of the organism. Kaya we should take note that infections may be prevented by eliminating the causative organisms from the reservoir. Third is the mode of exit. This portal of exit is the path by which a pathogen leaves its host. The organism must have a mode of exit from a reservoir, and this usually corresponds to the site where the pathogen is localized. An infected host must shed organisms to another or to the environment para maganap yung transmission. Organisms exit through, number 1, yung respiratory tract, pag bumabahing, pag umuubo. Second, the GI tract, through feces. Third, genitourinary tract, through the urine or reproductive secretions. And lastly, through the blood. Fourth is the route of transmission. This mode of transmission is the cause why infectious diseases spread and may cause an outbreak. A route of transmission is necessary to connect the infectious source with its new host. Pero may mga tao na carrier lang. Ano yung mga carrier? Sila yung mga tao na they carry or transmit an organism but does not have apparent signs and symptoms of infection. We divide the routes of transmission into two main types. The general transmission via abiotic environmental factors and animal vectors, and second, the human-to-human transmission through direct contact, indirect contact, droplets, airborne, and fecal oral route. Let us first look on letter A, general transmission. Pathogens can be transferred by environmental factors, such as wind and water. They can also be transferred from animal vectors, such as mosquitoes and fleas. Animal vectors also can further spread the disease through migration. For example, if carried by birds or fish. Second is the human-to-human transmission. This has been classified into 5 main modes. First is direct contact. Direct contact is when pathogen survives best inside the body and would include sexual contact, skin-to-skin contact, and even maternal and fetal route. Indirect contact is when the pathogen survives harsh environments and occurs when human excretes the microorganisms in a surface or in air. Then, another person touches the surface or inhales the air. Droplet transmission is close contact with the human's respiratory droplets and may also be considered a direct contact mode of transmission. These droplets do not actually survive longer periods of time. Hence, yung pagsuot natin ng effective face masks, they prevent both droplets and airborne transmission. Yung fecal oral route naman, it is through contaminated water or food. As an example, yung microscopic eggs ng ibang pathogens, they exit via feces. And since unseen siya by the human eye, it may enter the body through the mouth when drinking or eating. Kaya good hygiene and hand washing prevents this. These pathogens also are a large problem in developing countries like the Philippines. Now, take note that these 5 modes are not mutually exclusive. For example, yung Ebola virus, it can spread through direct contact and potentially through droplet transmission too. How pathogens can be transferred mostly depends on how hardy they are outside a human body. Take note too that some cannot survive for long periods of time, as mentioned earlier, so they require direct contact, droplet transmission, or transmission through an animal vector. Others, such as flu, can survive for long periods of time on surfaces, making them extremely contagious. The portal of entry refers to the manner in which a pathogen enters a susceptible host. This portal of entry is needed for the organism to gain access to the host. The portal of entry also must provide access to tissues in which the pathogen can multiply or a toxin can act. Most often, yung infectious agents, they use the same portal to enter a new host that they use to exit the source host. Ano yung mga modes of entry? Respiratory tract through coughing, sneezing. GI tract through feces. Urinary tract through urine. Skin through an open lesion, insect bite, or removal of blood. And also placenta. Yung placenta naman, it may be a route of entry sa maternal and fetal infection. Lastly, the susceptible host. For infection to occur, the host must be susceptible or not possessing immunity to a particular pathogen. A person who is immunocompromised has much greater susceptibility to infection than a healthy person. Previous infection or vaccine administration may render the host immune or not susceptible to further infection with an agent. However, although exposure to potentially infectious microorganisms occurs essentially on a constant basis, people have elaborate immune systems that generally prevent us from having infection. What now are factors that increase our susceptibility to infection? Of course, the very young and the very old. The malnourished people. And then yung mga bisyo, vices, cigarette smoking, alcoholism, substance abuse, or you really have a disease or you're taking drugs or therapy that as an adverse effect impairs the immune response. Here is a figure that shows a complete chain of events. And this complete chain of events is necessary for infection to occur. Pero kung titignan din ninyo, this figure illuminates or illustrates the elements of the chain and identifies points where healthcare workers can intervene to interrupt the said chain. Infectious agent pa lang, ma-identify mo agad yung organism and then kill that organism. Reservoir, be healthy, sanitation, disinfect, and sterilize. Portal of exit, wash your hands. Proper disposal of trash and wastes. Modes of transmission, again, wash your hands, sterilize, standard precautions, good flow of air, proper food handling, and if you really are sick, you isolate. Portal of entry, aseptic technique, catheter care, wound care as an example. And lastly, susceptible hosts, you treat the underlying disease and you recognize who the high-risk patients are. Another concept that we'll try to differentiate are the concepts of colonization, infection, and infectious disease. Pag sinabing colonization, this term is used to describe microorganisms present without the host's interference or interaction. Organisms reported in microbiology test results often reflect colonization rather than infection. Kaya ito yung nakikita natin minsan na culture and sensitivity tests na ginagawa kong malaman kung meron kang anong klasing pathogen sa katawan. The patient's healthcare team must interpret microbiology test results accurately to ensure appropriate treatment. What now is infection? This indicates a host interaction with an organism. May clinical evidence of redness, heat, pain, and yung laboratory evidence, mataas ang WBC, dun sa wound specimen, it may suggest infection. Nagkaroon na ng inflammatory reaction. A patient, for example, colonized with Staphylococcus aureus may have staphylococci on the skin without any skin interruption or irritation. However, if the patient has an incision, yung Staphylococcus aureus could enter the wound, resulting in an immune system reaction of localized inflammation and magmamigrate yung WBCs dun sa site. In this situation, the host identifies the staphylococci as foreign. Infection is recognized by the host reaction, manifested by the signs and symptoms, and by the laboratory-based evidence, again, yung WBC reaction and microbiologic organism identification. What now is an infectious disease? This is the state in which the infected host displays a decline in wellness kasi nga infected siya. When the host interacts immunologically with an organism but remains symptom-free, the definition of infectious disease has not been met. For example, when a person is infected with tuberculosis, infection can be detected by a positive tuberculin skin test, which demonstrates an immunologic recognition. Most people who are infected with TB have latent infection, but few people, approximately 10%, they actually become ill. They demonstrate the symptoms of TB, such as fever, weight loss, and advancing pneumonia. Sila yung meron ng infectious disease. Let us now go to how we control and prevent infection. Ang WHO and in the United States, yung tinatawag nilang CDC, they are the principal agencies involved in setting guidelines about infection prevention. And here in the Philippines, our government, DOH, we follow those protocols also. The impact of infectious diseases changes over time as microorganisms mutate, as human behavior patterns shift, or as therapeutic options change. Kaya very necessary for health institutions to provide timely recommendations about many of the situations that a nurse may face when caring for or teaching a patient with an infectious disease. Naging malaking senaryo ito nung tayo ay nasa kalagitnaan ng COVID-19 pandemic. Isolation precautions are guidelines created to prevent transmission of microorganisms, especially in the hospital. We have two general types. The standard precautions, they are designed for the care of all patients in the hospital, and it's the primary strategy for preventing healthcare-associated infections. Another is transmission-based precautions. They are designed for care of patients with known or suspected infectious diseases spread through 1. Airborne, 2. Droplet, or 3. Contact routes. Let us further discuss the isolation precautions. First, standard precautions. The premise of standard precautions is that all patients are colonized or infected with microorganisms, whether or not there are signs or symptoms, and that a uniform level of caution should be used in the care of all patients. The healthcare workers should use barriers. So ano-ano yung mga yon? Hand hygiene, use of PPE, including masks, eye protection, cover gowns, among others. Proper handling of patient care equipment and linens. Environmental control, prevention of injury from sharps devices, and patients' room assignments within the healthcare facilities. Next, some microbes are so contagious or epidemiologically significant that precautions in addition to the standard precautions should be used, especially when such organisms have been identified. Ito yung transmission-based precautions. Yung isolation categories niya, airborne, droplet, and contact precautions. So sa airborne precautions, when hospitalized, patients should be in an airborne infection isolation rooms. They are engineered to provide a negative air pressure, rapid turnover of air, and air either highly filtered or exhausted directly to the outside. Healthcare providers should wear N95 masks at all times kapag nandoon sa loob ng patients' rooms. They are required for patients with presumed or proven pulmonary TB, chickenpox, or other airborne pathogens. Second, sa transmission base ay yung droplet precautions. Should wear a face mask, but because the risk of transmission is limited to close contact, the door may remain open. Ano yung mga droplet precautions? Pwede siyang gamitin for influenza or meningococcus infection, which can be transmitted by close respiratory or mucous membrane contact with respiratory secretions. And lastly, yung contact precautions designed to emphasize cautious technique and the use of barriers for organisms that have serious epidemiologic consequences or those easily transmitted by contact between healthcare workers and patient. So, yung patient, no, kailangan ng contact isolation, nilalagay siya sa private room to facilitate hand hygiene and decrease contamination. Masks are not needed and doors do not need to be closed. Ano yung examples niya? Yung mga antibiotic-resistant organisms. For example, yung nagsaspread by skin-to-skin contact or Clostridium difficile. Here is a table summarizing types of precautions and patients requiring the precautions. So yung standard, airborne, droplet, and contact precautions. Remember again the chain of infection. These 6 links need to be connected in order for a disease to be transmitted. Therefore, if one link is broken, an infection will not occur. So it is necessary to break the chain. 1. Kill the pathogen. Standard precautions. Treat with medications. Second, prevent contact. No? Kung may sakit ka, isolate. Third, prevent its escape. Cover your mouth when you sneeze. Cover your skin wounds. Fourth, prevent transmission. I-control your infected animals or insects. Clean food and water. Clean the environment. Hand hygiene. Fifth, block the ports of entry. So wear face masks, cover skin wounds. And six, maintain a resistant host. You have to develop a strong immune system by eating balanced and nutritious diet, exercise, enough rest and sleep, and get immunizations as well. So this summarizes how we can help prevent infection, control infection dun sa level natin. What about preventing infection in the community? The government, yung DOH, at yung local public health units, they share the responsibility for prevention and control of infection in the community. One is biosanitation techniques. Second, yung mga regulated health practices na mga establishments. No? And third, yung mga immunization programs natin. On sanitation techniques, water purification is important, and disposal of sewage and other potentially infectious materials. Basic sanitation is having access to facilities for the safe disposal of human waste, feces and urine, as well as having the ability to maintain hygienic conditions through services such as garbage disposal, tamang waste management ng mga industrial and hazardous waste, and even yung wastewater treatment and disposal. Second is regulated health practices. For example, sa mga restaurants, the handling, storage, packaging, and preparation of foods by institutions. It's very important. Kaya nga meron tayong mga batas, no? May mga guidelines. Yung iba, may mga pinupost na certificates, yung mga sanitary permits. Ito ay mga ini-issue sa establishments. Third is the immunization program. The goal of vaccination programs is to use wide-scale efforts to prevent specific infectious diseases from occurring in a population. Vaccines have been proven to be effective. Public health decisions about vaccination efforts are complex, however. Kasi may risks, no? Pero may benefit din naman. The risks and the benefits for the person and the community must be evaluated, especially in terms of morbidity, mortality, financial costs, and the benefit. Ilan sa mga most successful vaccine programs have been ones for prevention of smallpox, measles, mumps, rubella, polio, diphtheria, pertussis, and tetanus. So dito sa Pilipinas, common vaccines na binibigay sa health centers, no? MMR, which is measles, mumps, rubella, varicella zoster also, no? Influenza. These are common vaccines. There are many DOH vaccination programs. But let us discuss one, yung EPI sa children, the expanded program of immunization. And second, the very recent COVID-19 doses and the boosters. So here, yung EPI in the Philippines, it began in July 1979. And in 1986, it made a response to the Universal Child Immunization Goal. The standard routine immunization schedule for infants in the Philippines is adopted to provide maximum immunity against 7 vaccine-preventable diseases in the country before the child reaches the first birthday. So, ano yung major strategies? 1, high routine full immunized child, at least 90% in all provinces and cities. Second, masustain ang polio-free country. Kasi polio-free na tayo. Third, sana ma-eliminate na ang measles. By 2008 pa nga yung goal na yan. Fourth, the same with eliminating neonatal tetanus. Same since 2008 pa siya goal. As mentioned earlier, isa sa mga premise ng EPI is by 1 year old, dapat fully immunized yung bata sa 7 vaccine preventable diseases. So ano yung mga sakit na yon? Sa BCG, yung extrapulmonary TB, diphtheria, pertussis, tetanus, polio, hepatitis B, and measles. Let us review these vaccines. So BCG, Bacille Calmette Guerin. It's given at birth or anytime after birth. Isang dose lang siya, 0.05 ml, intradermal, pwedeng ibigay right deltoid region of the arm. The BCG given at earliest possible age protects the possibility of TB meningitis and other TB infections in which infants are prone. Yung primary complex, no, for example. Second is DPT 1, 2, and 3. It's given in 3 doses, 6 weeks DPT 1, 10 weeks DPT 2, 14 weeks DPT 3. So, gaano siya kadami? 0.5 ml IM, upper outer portion of the thigh or the vastus lateralis. Minsan sa health center, left, right, left. Yun yung pagkakasunod-sunod niya, no? An early start with DPT reduces the severity of pertussis kung magkakaroon man. Next, yung OPV 1, 2, and 3, oral polio vaccine, given at 6 weeks in 3 doses, 4 weeks apart. Gaano siya kadami? 2 to 3 drops oral. The extent of protection against polio is increased the earlier the OPV is given. This keeps the Philippines polio-free. Pero meron na ngayon na ini-inject din, no, na polio vaccine. Fourth, Hep B 1, 2, and 3. It's given at birth, 3 doses, 4 weeks apart, 0.5 ml IM. Same with the DPT, upper outer portion of thigh, vastus lateralis, pero this time naman, right, left, right. Pero okay lang kahit magkapalit naman yan, no? An early start of Hep B vaccine reduces the chance of being infected and becoming a carrier. It also prevents liver cirrhosis and liver cancer, which are more likely to develop if infected with hepatitis B early in life. About 9,000 died of complications of Hep B, and 10% of Filipinos have Hep B infection actually. And lastly, yung measles. Given at 9 months, isang dose lang siya, 0.5 ml, subcutaneous, upper outer portion of the arm, no? Pwede sa right deltoid. At least 85% of measles can be prevented by immunization at this age. Another is the tetanus toxoid immunization for women, TT1 until TT5. So I hope you read, study, and review on this chart. When given to women of childbearing age, vaccines that contain tetanus toxoid does not only protect women against tetanus, but they also prevent neonatal tetanus in their newborn infants. Kaya madalas na ibibigay ito dun sa mga buntis. COVID-19. Are you vaccinize against it. So we have several COVID-19 vaccines available in the country. Unang-una yung Sinovac, nagkaroon ng AstraZeneca, Pfizer, Moderna, among others. No? Some of the COVID-19 vaccines differ. They have similarities, they have differences. But as we know, medyo marami nang na-vaccine sa Pilipinas. Nabawasan ang cases natin, unlike nung talagang intense yung cases. No? So we can see that because now many people are vaccinated, it was effective because somehow we have returned to the new normal. What do we know so far about these vaccines? Again, vaccines are being tested. Alam natin na ang paggawa ng COVID-19 vaccine ay naging mabilis. Dahil kung hindi bibilisan, baka hanggang ngayon, nasa kalagitnaan pa rin tayo ng mga lockdowns. No? That's why many countries developed vaccines based on their expertise, and they were able to help other countries get these vaccines para matulungan ang pagbaba ng cases. Ideally, vaccines have side effects, gaya ng side effect ng ibang gamot or ibang vaccine. But it should be limited to pain sa injection site, fatigue, headache, sometimes chills, sumasakit yung joint, or maybe fever. But other than that, of course, wala dapat magiging hindi magandang epekto ang vaccines. As of now, the goal is for herd immunity to happen. Because in such a way, we can really control the COVID-19. Makokontrol natin yung spread ng infection. How do we address infection? In terms of nursing management, of course, we utilize the nursing process. First is assessment. The health history and physical examination plus yung pag-interpret natin ng diagnostic and laboratory tests, they are all important for determining the presence of infection and infectious diseases. Symptoms of infectious diseases may vary significantly between and within diseases. For example, may visible symptoms, rashes, redness, swelling, mga early warnings yan of infection. But in other infections, example, TB and HIV, asymptomatic siya, no? Yung infection must be determined through diagnostic or laboratory procedures pa. Next, we have to diagnose after assessment. When we say diagnose, we do the nursing diagnosis, not the medical diagnosis. So ano yung mga possible nursing diagnosis? Kung wala pang infeksyon, may risk for infection. Kung nilalagnat, hyperthermia. May acute pain, fatigue, activity intolerance, impaired physical mobility, impaired skin integrity kung may skin infection. So, those are the likes. Third is to plan. After you have identified your problem, what is your plan? You have to address your goal. You have to correct the problem. So, for example, may risk for infection. Ang plano mo, hindi mag-develop ng infection. Kung ang nursing diagnosis mo, hyperthermia, what is your goal? Mawala yung lagnat. If your problem is acute pain, mawala ang pain. If your problem is fatigue, mawala ang fatigue. If your problem is activity intolerance, matolerate ang activities. If your problem is impaired physical mobility, mag-improve ang physical mobility. And if the problem is impaired skin integrity, mag-improve ang skin integrity. So you just make your diagnosis a positive one, and that is your goal. Pero kung wellness naman yung mismong diagnosis mo, because there are wellness diagnoses, so yung goal mo is to maintain that wellness. What about the fourth step of the nursing process, yung implementation, yung intervention? So pag may infection, of course, nurses should know or intervene to prevent infection transmission. Nurses should also teach about the infectious process sa clients, no? Also, importante yung pag-control ng discomfort. Gaya nga nung may hyperthermia, may masakit sa kanya. Also, nurses should monitor and manage for potential complications of the infection. Take note that when we intervene, no, pag may infection, collaborative din siya kasi tayo ay nagbibigay ng mga gamot na order ng doktor. So we have to work with the healthcare team. And lastly, evaluate. Was your goal, has your goal been met or not met? And then, ano ang dapat mong gawin kung hindi mo siya na-meet or partially meet lang? So, ang gagawin ng nurse, ang nursing process, no, this will best help the client and the community, especially when we are dealing with the infection or the infectious disease. That's the end of the lecture for this topic. Thank you very much.